Welcome once again. This is ESICON 2018 in conversation with Dr. Jubin Jacob. He is the professor and head at the Endocrine and Diabetes Unit, Christian Medical College, Ludhiana. Welcome, sir, on board here at ESI TV, which is an academic initiative, and all we're trying to do is give our audience current news, updates, clinical developments from the scientific program at ESICON 2018. So once again, a warm welcome. How has the experience been so far here with us?
Thank you. I think the hospitality has been great. I think the city is great. It looks all new. The roads look all perfect. So I've enjoyed to date or till this time.
That's great. Now let's get the talking done. Okay. Let's talk about the area of interest and area of expertise.
All right, so I'm sure everyone here is an endocrinologist, so our main areas are diabetes and hormone related, and my main area of expertise probably would be currently I'm doing a lot of research on an area called hyponatremia, which is not really considered an endocrine disease, but I think it is a very, very important endocrine area which does not get the attention that it requires, and it's a very, very common condition that you encounter in patients who come to the hospital.
Sure. So let us have a brief conversation as far as hyponatremia is concerned. Also talking about the current advances and treatment or the drug monitoring. How about the term?
All right. So hyponatremia, from the word itself, you can figure out it essentially means that you have a low sodium. That is a very important electrolyte in your body. The serum levels of sodium are lower than what you would expect. And now the problem with having low sodium is usually you require normal sodium to keep the tension in your blood. That is what we call the osmolality. Yes. It's a very unusual name. It's called osmolality because that is the tension in your blood, and that's how the fluid movements take place between the cells and outside. So if you get a low sodium, the osmolality in the blood goes down. So that means now there is a tendency for water to leak out from the cells, and that is the reason why these patients with hyponatremia will develop symptoms, primarily CNS symptoms. They'll become unconscious, they may develop seizures, and in a rare case they may even succumb to this particular complication. So this complication is actually very, very common in hospitalized patients, and especially in older patients who come to the hospital. Anyone say over 60, 70 coming to the hospital has a 1 in 33 chance that patient may have hyponatremia, and if this is not addressed properly, it can have serious consequences.
Sure. So what would that one keynote giveaway message for our audience be?
I think the main message I would think is that hyponatremia is easily identified, but it is not approached in a proper manner in most contexts that I see. And there is a lot of steps that you follow, and if you follow, you can come to a fairly conclusive conclusion about what the cause is, and the treatment will depend on the cause. There is no one single treatment. It's not that anybody with a low sodium, you put in sodium, he's going to get better. He's not going to get better because it's not really a problem with the sodium. It's actually, when you get low sodium, it's a problem with the water. You have too much of water in your body, and that is what you have to address. And I think that really, that is an area where we feel that, there is a lot we could contribute to.
Sure. Now let's also have the session topic discussed.
All right.
So some insights on same.
Okay,
please.
so I've been asked by the organizers, Dr. Sambit, who is the scientific secretary, to talk about gonadal dysgenesis. Yeah. Now that is an unusual topic in the sense it's not a topic that is commonly encountered, and it is a very, very pure endocrine topic. Gonadal dysgenesis, again, as the word says, it's something's wrong with your gonads. So the common kinds of gonadal dysgenesis are where you have a chromosomal abnormality and you're born with an undeveloped gonad, and that happens in women in a syndrome called Turner syndrome, and men, again, very commonly a syndrome called Klinefelter syndrome. Now, I'm not going to talk about these conditions because they are common and most endocrinologists are very well aware of it. So I'm talking about condition where there is nothing wrong with the sex chromosome, but still the gonads do not function normally. And this usually happens because, unlike what many people think, it is not just the sex chromosome which is responsible for the development of the gonad. A lot of other chromosomes are equally important. And you may have inputs from various chromosomes, and any of these inputs get hindered, or you have a mutation in the chromosome that leads to a wrong message to the gonad will be dysfunctional. And then if the gonads are dysfunctional, you know you will not make the hormones. If you don't make the hormones, you end up with a lot of deficiency, and that leads to a lot of problems with sexual development and subsequently with reproduction and other things.
Sure. Also talking about the different innovative concepts that ESICON 2018 has come up this year, the EPL, the
I think, yes, I think EPL was very exciting. I think that was and the other thing that I found was last night, all the dinners were organized as per the alumni of various institutes got together and then dinner together. That was again very unusual, and I enjoyed the panchayat today, and I think and that was also quite new.
Yes, so the sports and endocrinology module is coming up.
Okay, I'm not a very sportive person, so but I think I can understand where it comes from. I think a lot of endocrinologists are now encouraging sports. I think that's something that we should be putting our full attention on, especially with children and things like that. So I think sports and endocrinology is good. And I also like the Make in India talk, and where you are specifically talking about the contribution that India had to science as a whole in endocrinology. So that these are few very interesting concepts, I think, this year.
Thank you so much, Dr. Jacob, for joining in with us here on ESI TV. We've had a quite informative conversation right here. Thank you once again for joining in with us.
Thank you very much for having me here.